Hi, my name is Shina Rogundade, co-founder and CEO of Myltura. What inspired me to start Myltura was basically a personal experience I had sometime in 2022. In September, we lost my dad. A few months before that, we had lost his doctor. And after the doctor died, that was my first real exposure to what the healthcare sector was lacking and how lack of health records could basically cause a death. In April, we lost a family doctor of over 17 years who had become a family doctor and had supported the family. And the months that followed, I remember we saw about 6 different doctors, but for every doctor, we had to narrate our story from the scratch. We had to do basically the same test. And it was sad because I kept asking, how come health records are not digitized? How come there's no continuum in health records, the way we have in the financial sector, a BVN that could easily spool a customer's details. In the healthcare sector, that was lacking. Trying to solve for these inspired me to start Myltura basically. I think the biggest challenge we faced starting Myltura was the lack of infrastructure. Generally in the healthcare sector today, most things are handwritten, paper-based. You could rarely get APIs, or you could rarely get platforms to integrate with to spool health records. Even though we have electronic medical records platforms, EMR, trying to get the details from there to allow for interoperability is still hard. Infrastructure is rare. Second is the cultural differences. I think, part of people getting used to writing with hand has also led to a culture where people just prefer things. Convincing people to go digital or see the need for digital has also been a major constraint or a major challenge. And finally, the healthcare sector generally is not as rich as we would have hoped. It's not as rich as we would have hoped. Even though today in Nigeria or for 2025, we have a high budget for healthcare sector. The reality is private healthcare sector providers or even government healthcare providers don't have the necessary finance. I think in 2023, across all the healthcare insurance companies, the health insurance companies in Nigeria, the total revenues for all of them combined was less than 60 billion naira, compared to a budget of over 2 trillion naira. And these are things that needs to be solved for. These are major challenges the healthcare sector is facing. Solving or building products for 20 African countries, with my experience in risk management, has shown me that different markets have different nuances. The regulatory environment across markets are different. The people in the markets, the customer culture, customer behavior to things are different. And even the level of adoption to technology is also different. So for every market you want to build a product for, every market you plan to go into, you need to first understand what does the market need, what's the market asking for, what's the best way to go into that market and drive adoption without necessarily having a latch on. I think bringing this into the healthcare sector also helped us at the very early stages to do a lot of experiments with Myltura, test the market, see how the market react to things, pick what's working and drop off what's not working, basically. For providers, the strategy we've employed is to meet them where they are, is to try to understand them. I think on the Myltura board today, we have on Myltura, we have 3 advisors helping us with go-to-market strategy across different healthcare providers, and also sitting with the healthcare providers to understand their core needs and build around what their core needs are. For patients, how we build trust is to show them, around your data, we've considered things like data privacy, things like interoperability, why you have control over the interoperability, and to make them understand continuum of care gives you a better chance at better healthcare compared to when things are manual or your records are just kept in one hospital and another doctor is not able to use that. Amazing. In terms of balancing, I'd say today we are not necessarily thinking around profitability. What we are thinking around is scaling and efficiency. How do we scale Myltura? How do we get more users? How do we help people to have control over their own net records? And how do we allow for interoperability? Creating scale or thinking around scale, onboarding more users, because beyond just building a product, we are making a cultural shift from what we used to be to what we need to be. So the thinking today is not a lot around profitability, it's a lot around scaling and efficiency. I guess, like I said earlier, different markets have different behaviors, different regulatory environment, different needs, right? I think the key thing founders in the BIM market should understand or look out for is what is peculiar to their market or what is peculiar to new markets they are trying to conquer, and how do they work. At times, the best way to go around this is to seek advisors. For instance, personally, I had no healthcare experience when we started, but how I was able to build or solve around this was to bring on people with core healthcare experiences, surround myself with them, ask questions when there is need, sit with them, understand what they need, and even get feedback at every point. Test very quickly, iterate very quickly, and approach the market. I think in summary, understanding the market, the core needs of the market, and building around the core needs of the market is important for the founders here. Amazing. So today, what Myltura does are in three phases. One, we close accessibility gap to patients. So we have tools, platforms, apps that allows patients to easily reach healthcare providers and allow healthcare providers to, serve their patients from wherever, even those in rural areas. Two, we've built tools that reduces the cost of a patient going to a provider. Basically, from your homes, you could talk to a doctor easily via a video call, voice call, or a chat on the Myltura platform. You could book a health test, and someone comes, to you. Even at these, even though we close these accessibility gaps, we make this affordable through our tools. And finally, we allow for interoperability, so there's continuum of care at every point. You talk to a doctor today, you talk to another doctor tomorrow. A new doctor is able to see, oh, where is this patient coming from? What has he been diagnosed of in the past? What tests has he or she done in the past? What were the diagnoses? And also, what drugs were they given? And how can I better this, basically? And in terms of tracking, today we track how many calls or telemedicine calls that's happened on the platform, number of telemedicine calls we've had, number of tests booked on the platform, number of prescription deliveries that has been done. Today we do healthcare outreaches, working with corporates, working with development organizations, and we're able to provide better care. And all these are being tracked with the number of people that our lives we touch with through the platform. Mentorship, I'm a product of mentorship and advisory. I think especially like me, if you come into a space where you previously did not have any experiences, you need mentors, you need advisors, you need guidance. To go forward, you need people to handhold you, show you the ropes, right? When you want to enter certain rooms, maybe to close partnerships or to get a license, you need people to guide you, because at times when you go yourself, you might not fully understand the full scope, and it might make things harder for you. But having mentors or advisors who have walked the walk you want to go on shortens the journey. They help you see new perspectives. For instance, the core product for Myltura, the major product we are pushing today, will be on the testing side, and an advisor helped us to see this, that this might be the way we are going about it today. An advisor helped us to see, oh, the way you are going about it might be right, but you need to go about it this way. And testing it in the new way, scaled us very quickly. So having mentors, advisors, even as an underrepresented founder, and at the end of the day, you don't have to lose too much to bring these people on board. For some, you don't even have to pay them salaries. You just need to agree. Or for some, it might just be shared objectives or shared vision that is enough to convince them to come on board. So having them, working with them, shortens the journey and helps you get where you need to get faster. So the healthcare sector in Nigeria is still there's still so much to do, right? There's still is in their need of technology. 2 years ago, when we're starting our Myltura, I remember we're looking for healthcare providers that had API calls people could connect with, or that we could integrate with, APIs rather, that people could integrate with, and there was none. But over the years, we've grown to a stage where a number of startups now have APIs. I'm sure for BIM founders, that might not be the case, but what's important is what are the needs in the market. Technology at every point seeks to improve things, at every point enhances things. If there are diagnoses that needs to be made, technology could help improve that. Today, we are not just talking about technology. The new reigning thing in town is even AI. A number of AI use cases are starting to spring up. With AI, you can improve drug delivery. You can test hypotheses around how a drug is created to improve the efficiency. You can shorten time to diagnosis. And these are things that, one, the founders need to understand what are the needs, what are the core needs in the market, and seek out technology, and now AI could help solve for that. Okay, my advice to founders in the BIM region would be to, at every point, stay open, allow innovations to do its work, be open to working with people from other areas, find ways to seek advice, especially when building for customers who are culturally different or culturally not aligned with where you are coming from. See people, better understand them, work with them, and basically grow from there. In terms of working with investors, that might be a bit tricky, but at every point, I'm a firm believer that having a sit down, trying to understand the context of the other person does more good than going with your own understanding or forcing your own understanding on maybe a customer or an investor. Trying to understand where the other person is coming from could help solve some of these issues. Yeah. So I like to say that where we have healthcare currently was probably where fintech was in 2014, 2015, where we saw there was, we could see that there's potential, but we're not certain of how the potential will actually map out, and that's where the health sector today we are starting to see a lot of potential, but we are not sure yet where we lead to. However, one thing is clear: the market is huge. In Nigeria alone, we are talking around over 200 million people, and these 200 million people ordinarily need as simple as health insurance. They need health insurance. Digital health also needs to come to play, at some point, because we are short staffed in terms of doctors. We are short on hospitals. We are short on a number of physical tools. That digital tools needs to come in and play around. So the market is huge. The potentials are there. We just need to build solutions that the market can understand, and then give a bit of time for the market to fully adopt some of these tools and grow into them. So yeah, I think different things. For instance, today, adoption of telemedicine in Nigeria is still quite limited. Because people still prefer touch points. I'm sure in Scotland the case might be different, because there's more phone penetration, there's more internet penetration. Phone and internet penetration in Nigeria is still, a bit less, and people still need to understand how telemedicine could work could work for them. For diagnosis or for health testing rather, people in urban areas are starting to accept their possibility of a phlebotomist coming to pick up their samples, which is something I'm sure Scotland, there might be more advances in areas like Scotland that, they can build around. Why diagnosis? I think we are in an age of AI, so we are all coming to that stage where diagnosis could work easily for both. In Nigeria, for instance, there's more interest in data gathering, training models that understand the local context, right? So these are things that could work basically in both markets.